Steve Borisenko lost his son to an accidental overdose less than a month ago. The drugs were laced with fentanyl.
He passed away June 11th in the morning. It was a shock, as it would be. It's unbearable sadness.
Jacob Borisenko was 21 years old. He was working at General Motors and loved playing hockey in his spare time.
He loved his friends fiercely, loved his family. He was stubborn, and he had his own mindset, and sometimes it was difficult to deal with him, and we had problems. These lockdowns didn't help. It made him sad.
Steve says the pandemic was especially tough for his son.
It ended up self-medicating, and then he started self-medicating through street drugs, and that's where the fentanyl comes in.
From January to May of this year, Niagara EMS have responded to 330 suspected opioid overdoses. That's an average of 66 per month.
2021 has been the highest year ever for opioid overdose responses by Niagara EMS. Definitely a marked increase from 2019 to 2020, and now being about halfway through 2021, it looks like, unfortunately, we're going to be surpassing our 2020 numbers as well.
I can find out how many people walked into the St. Catharines hospital with COVID right now. I can't. It's hard to dig up stats for fentanyl overdoses in the Niagara region, and that's not right.
Steve wants these stats and more information to be easily accessible, especially for young adults. Together with his friend and business partner, Steve launched the website Jacob's Wall, just 3 days after his son's tragic death.
I find I'm happiest when I'm fighting. That gives me purpose, and that makes his life worth something to me. He was 21, he didn't have time. There wasn't enough time. But if in his death and in his tragedy, we can find something to save some other ones, how can I not?
He's looking to create an app that takes steps towards overdose prevention, like allowing users to create emergency contacts that will automatically be notified if the user thinks they or someone around them is at risk of overdose.
One of the COVID messages has been about, not gathering in groups, but when it comes to using drugs, we want someone to always know where you are and always have an ability, if you do overdose, to call 911.
Steve also hopes his app will amalgamate the work of local organizations to one accessible place to go for help.
We have to do something about it. We don't have a choice.
But Steve is looking for help. He's trying to raise money to fund it and find a developer to build the app, and is hoping to get police and hospitals on board. Emily Tayler, CHCH News, St. Catharines.